Welcome back, everyone. We're going to start the OBGYN lecture series with reviewing the female anatomy and looking at some of the gynecologic emergencies that are relevant to the obstetric and gynecologic patient. First and foremost, let's talk about the female body and pregnancy a little bit. First of all, pregnancy is not a disease that needs treatment. Childbirth is usually a happy event, and the entirety of the human species has existed through normal childbirth. So while oftentimes encountering a gravid patient, or the term used for a pregnant patient, can be daunting as we don't see a lot of pregnant patients within EMS, this is a normal process, and there's some important things that we need to understand about the reproductive system and the organ systems within the female body and some of the physiologic changes that occur with the gravid patient. There's no disease here. This is a normal process that occurs within the normal human body. And by and large, most of the patients that we encounter are going to be relatively routine, and even most of the childbirths that we encounter are often routine. One thing to remember, that the number of patients does increase from 1 to 2. A fetus in utero is its own, depending on its gestational age, has its own circulatory system, its own metabolic system, has its own heart rate and necessary needs for nutrients and oxygen and expulsion of metabolic byproducts, just like the gravid patient does. So you do have 2 patients to assess. You should be assessing both of those patients accordingly and comparing your assessment findings with what we would consider normal or non-notable against their specific developmental time frame. The female reproductive system or organs consist of several components. You've got 2 ovaries, one on each side. You have 2 fallopian tubes, the uterus, which is the womb for the child, the cervix, which is at the most narrow end, the proximal end of the uterus, the vagina, which is the birth canal, and then you have mammary glands and the external genitalia. With the ovaries themselves, each ovary contains about 200,000 follicles, with each one containing an oocyte, or what will eventually become an egg. Each month, about 20 of those follicles begin the maturation process in preparation to be secreted as an ovum, and only one of those 20 will be secreted as an ovum during the menstruation process. The ovaries do alternate each cycle. So one cycle, the left ovary may secrete the ovum, while the next cycle, it's likely that the right ovum will secrete. The cycle continues with the release of hormones throughout various stages. The anterior pituitary gland releases 2 hormones predominantly. One is follicle stimulating hormone, and the second being luteinizing hormone. At the end of the pregnancy, prostaglandins and oxytocin signal uterine contractions and labor. And if you remember back from our discussions in anatomy and physiology, that the secretion of oxytocin is one of the handful of positive feedback systems within the body. That the secretion of oxytocin encourages uterine contraction. The uterine contraction puts pressure on the cervix, which causes the release of more oxytocin, which causes more contraction. During the maturation phase and menstruation cycle, once the follicle has transitioned into the ovum is released from the uterus, and it's swept into the fallopian tubes by ciliated cells at the end of the fallopian tube, moves it into the fallopian tube, and then smooth muscle contractions in the inner mucosa move the ovum through the tube into the uterus. This process is not instantaneous, and it actually takes several days from release of the ovum for it to actually make its way into the uterus. The fertilization of the ovum into a zygote actually occurs within the fallopian tube. So when sperm is delivered into the vagina, it makes its way through the cervix, through the uterus, up into the fallopian tubes, where it then engages with the released egg, and fertilization can occur. Once fertilization occurs, the first cleavage or happening of the cells, not happening, halvening, where they split, where they go through meiosis, is right around the first day. And then by day 2, those cells begin to duplicate and reproduce exponentially as the cell makes its way and moves into the uterus for implantation. Generally, it takes about 8 to 9 days post-fertilization for the implantation in the uterus to occur. The uterus itself is the organ that lies between the urinary bladder and the rectum. The uterus is where the fertilized ovum will implant, the fetus will develop, and then where labor will subsequently take place. It's comprised of 3 layers of tissue. They're muscular layers. You have the endometrium, which is the innermost layer, the myometrium, which is the middle muscular layer, and then the perimetrium, which is the outside lining. The cervix is at the base of the uterus and is the opening to the vaginal cavity. Most often when we see images in textbooks or presentations, you're seeing a uterus displayed in this manner where it's a perfect vertical up and right sort of presentation, but that's not really how the uterus lies within the female body. You can see if we start from the vaginal opening and move up to the cervix that the uterine muscle actually lays anterior, so folding toward the front of the body, and then superior of the pelvic girdle. And that sort of fold and curvature makes things like childbirth somewhat complicated, which we'll talk about when we get into those portions of this series where the baby's head has to kind of move and shift around those structures to make it through the birth canal appropriately. The vagina itself is the highly muscular organ. It's lined with mucous membranes. The functions include it's a receptacle for the penis during sexual intercourse, the passage and exit of menstrual flow for when an ovum is not fertilized and the uterus will restructure. That material is exited through the vagina, and it's also the passage of the infant through the birth canal. The vagina is the lower portion of the birth canal. It will stretch to accommodate fetal delivery, but it doesn't always stretch enough, and there can be tissues in and around the perineum that will tear, and this can cause some pretty significant pain and bleeding. There are times in facility, and we don't do this procedure pre-hospital, but an episiotomy is a surgical incision of the perineal area to prevent the tearing that can be stitched post-delivery. But this is one of the complications to the maternal patient post-delivery that you need to be aware of. Mammary glands are modified sweat glands. The primary purpose is for lactations. And one of the indications that a woman is pregnant is breast enlargement, tenderness, and then ultimately milk excretion.